My name is Dr. Tracy Breen, and I am the Division Chief of the Adult Endocrine Diabetes and Metabolism Division. I'm going to be speaking to you right now about transitioning from your pediatric diabetes group to the adult diabetes group. I'll also tell you a little bit about our team so you know who we are. Typically, we make the transition from the pediatric program to the adult program sometime around age 18. This can be a challenging time for many young patients. There's a lot happening in your life at that time in addition to your medical treatment. You may be going away to school, you may be getting your first job, you may be living on your own for the first time, you may be getting your own health insurance or changing off your family's health insurance. So all this is happening pretty much around the same time, and that leaves a lot for you and your family to handle. So I'd like to talk a little bit about some of the things that we can do to help make that transition easier. Since we know that the transition typically happens around age 18, it's a good idea to start talking to your pediatric diabetes team about a year in advance as to when that transition is going to happen. There are some differences in terms of how the pediatric diabetes team is helping you manage your diabetes and how it's going to happen at the adult side. Some of those differences will be apparent on your first visit. When you begin to transition from the pediatric side to the adult side, some things are going to change in terms of how you and your family have been approaching your diabetes. As you've been working with your pediatric team, your family has been very involved in supporting you and helping you manage your diabetes. Your family will continue to be very important in your management, but as you begin your adult journey, a lot of these responsibilities are going to have to move to you now. It's a good idea in your transition year, while you're still in a place that you're comfortable with, to start taking on some of these new responsibilities. Those could include making your own appointments, making sure you have enough of your own medical supplies, maybe even ordering some of those supplies, and beginning to understand your health insurance and how that might change as you transition into your adult phase. Our adult endocrinology practice consists of several endocrinologists who are very well experienced in managing both type 1 and type 2 diabetes. We have a full-time diabetes nurse educator as well as a full-time diabetes dietitian who's also a certified diabetes educator. We participate in insulin pump training. We do continuous glucose monitoring. We have diabetes education for both the patient as well as the family. And we also are a close partner in the North Shore LIJ Diabetes Wellness Program. This is a series of outpatient diabetes education classes that patients can attend with their families, and we have additional support services as well. So we are very excited to help you in this transition process. Communication is important, and again, starting that process with your pediatric diabetes team early on, when you know when that transition is going to happen, is very helpful to you and your family. We look forward to meeting you when you're ready to make your transition, and look forward to helping you on the next phase of your journey.